And the World Health Organization has warned that there could be no return to normality anytime soon, as too many countries are bungling their response to the coronavirus pandemic. The UN Health Agency says the pandemic is only going to get worse unless people stick to the basics of physical distancing, hand washing, and wearing masks. Already, the novel coronavirus has killed more than 578,000 people and infected more than 13.3 million since the outbreak emerged in China last December. And joining me to discuss this is a medical doctor, Femi Oyeko. Good to have you join us, Dr. Femi Oyeko. Now, what do you make of this statement coming from the World Health Organization? Initially, they stated that a lot of countries are not using the tools at their disposal. And now we're also hearing from them that we are not returning to any form of normalcy anytime soon.
I'll be very honest with you. Is as truthful as that can be. More importantly, based on the fact that there's a very huge discrepancy of resources. If you look at countries like India, Nigeria, South Africa, you agree with me that the problem we are having is the fact that there are people maybe in the suburbs, in the nooks and corners of the country, that we may not be able to reach them, but they have this virus and they are going to continue to spread it. So in a way, it puts us in a huge fix, because if you're saying that you have centers in Lagos or maybe in New York or maybe in London that are credible of testing, what about all those little corners that sometimes those houses don't even have address? So it's difficult to say that you can assess them properly. So those are the situations where we say that even though we are able to, what the WHO leader was saying, that even though we are able to resolve the pandemic on a global scale, you're still going to be having some endemic cases and some epidemic outbursts in some of these small corners that's still going to pose a big problem. So in a way, no doubt, the truth is coronavirus has come to stay, and we must look for how we can adjust ourselves to ensure that the devastation is managed credibly.
So what can we do then, especially for those areas you just talked about? Almost every country has rural areas where it's difficult to reach. So how do we bridge that gap?
I'll say that it's a difficult task, no doubt, but we must, the solidarity movement, which the WHO president talked about, is what we need to embrace. Talking about credible sensitization, strong leadership from the center, spreading down to the very last, even if it's councillor, even if it's market woman, all these opinion leaders. There must be the fact that hand washing, face masks, social distancing shouldn't be compromised. If we as a people do this, that's why yesterday I was listening to I think my friend Otitoju, when he was talking about the governor of Ogun State insisting that Ogun State is not right for religious program yet. I will say that it is a very credible move by that gentleman, and it should be commended. And we as a people needs to know that if this is a global pandemic, we shouldn't pretend. We shouldn't pretend as if
allow me butt in here. Allow me butt in here, Dr. Femi, because like you rightly said, we shouldn't pretend about this. But even as of this morning, we're hearing from some sort of celebrity here in Nigeria that there is no such thing as coronavirus. And we've also seen, that personal responsibility from people and the rate at which people, will wear their mask and social distancing drop to a really terrible level. People do not even follow these guidelines anymore. So how do we enforce in a way that we do not also breach the rights of people?
I'll say that first, it is very normal for people to be skeptical, but the situation in Nigeria is one that leaves is one that nobody should be in doubt. If as sad as it sounds, the chief of staff of Nigeria died of COVID-19. Senator Ajimobi died of COVID-19, and then people El Rufai, the governor for Oyo, people are coming out to say, I've tested positive for the virus. Funnily enough, I worked in intensive care unit where I've seen people who, apart from COVID-19, they were healthy people, very healthy people, eventually die of this disease. So it's going to be difficult for me to now come out to the media and say, no, this is pretending. But as much as it's going to be difficult for some people to believe, if we that have the responsibility and we know that this is true, we must do our job credibly. We must do our job. We must not let, because there are folks that are coming out to say this is something that we should put aside. This is something that is capable of credible devastation. Let me put it that way. So it's not something to be put aside.
Medical Doctor Femi Oyekon, thanks for talking to us.